My name is Jake. I'm a program coordinator here with AC, and I'm presenting an overview of one of our medications today. That is diazepam, or Valium. It's a benzodiazepine as a classification for this medication. These are also referred to as sedative, hypnotics, or anxiolytics. It is a controlled substance as it's a Schedule I drug. Its mechanism of acting is it's a short-acting sedative. It has hypnotic and amnesic properties, meaning it can cause like anterograde amnesia following administration. Benzodiazepines help facilitate the activity gamma aminobutyric acid, also known as GABA, at these receptor sites. This helps reduce neuronal excitability. Indications, things we use this for, are sedation of patients, especially intubated ones, seizures, control of seizure disorder, active seizures, controlling combative or anxious patients, any conscious procedural sedations, and as an induction agent for RSI. Contraindications of this drug are, as with anything, hypersensitivity or allergy. The big thing to keep in mind is that they can cause respiratory depression. However, as contraindications go, this is very relative, simply because the adverse of not having it available to control seizure activity, for instance, I'd rather control a seizure and be able to adequately ventilate somebody than I would be worried about them currently being apneic. That's a relative contraindication. And as with anything, they can have amnesic effects. A lot of times that's part of what we give them for, is for the purposes of procedural sedation, and sometimes it's helpful that they forget about that painful procedure following. Precautions to have with this are that the effects of any benzodiazepines can be heavily potentiated by any other kinds of CNS depressants. If the patient's had things like excessive alcohol or narcotics. Other common examples would be if you're giving promethazine, for instance, as an antiemetic, that has CNS depressant qualities. And if you give something like a benzodiazepine as well, it could cause pretty profound respiratory depression. For dosages, for adults, we use this for sedation, behavioral emergencies. For sedation, our dosing is 2 to 5 milligrams. You can give this intravenous, intraosseous, intramuscular, or intranasal. It varies, but the general national range is that you can give this every 10 to 15 minutes, generally on the more range of 10, and I think the maximum dosing is closer to 10, depending on what your local protocols say. For behavioral emergencies, it's the same dosing schema through the same routes. And for seizure control, it's the exact same. So 2 to 5 milligrams IVIO, IMIN. Our pediatric dosing, it varies. It can be anywhere from 0.05 to 0.1 milligrams per kilogram IVIO. And you would increase that dose to the 0.1 to 0.2 milligrams per kilogram range whenever you're administering it through a slower acting route like intramuscular or intranasal. Pearls with this medication, it's not frequently carried as a first-line benzodiazepine in EMS. However, you may frequently see it used in the field in the form of an auto-injector that's referred to as a Diastat. The brand name is the Diastat AccuDial. This is an auto-injector that delivers a rectal gel that's administered via auto-injector to control like breakthrough seizure activity, especially in pediatrics where they're still working on identifying a dose for an anti-epileptic measure. Understand that it's just like an EpiPen, where if something like this had been administered prior to arrival and it's not yet controlling breakthrough seizure activity, you can administer additional doses of benzodiazepines. However, just be cautious that anytime you increase the amount of benzodiazepines on board, especially in children, that the chances of respiratory depression following that are higher, and you're going to need to be aware of that and closely monitor their oxygenation and ventilation status following that, in case you're having like a disordered control of breathing episode following that.